Good evening. Welcome to our Temple Micah panel on how we are dealing with COVID, what we can expect as the summer ends and we enter the fall and our high holy day season, and we begin to attempt to return to in-person worship and other activities at Temple Micah, and in the larger world, what we might expect as we see that COVID is not going away. Once again, we have with us two wonderful members of our Micah community. We know them well at this point. We're very, very glad to know them so well. Dr. David Skorton, as we all know, is president of the American Association of Medical Schools, and Dr. Richard Katz is on the faculty of Johns Hopkins Medical School and is medical director of Mount Washington Hospital in Baltimore. Not with us this evening as a panelist, someone who we usually have with us is Dr. Manya Magnus. The three of them have been part of our Temple Micah Medical Advisory Team. Dr. Manya Magnus, due to the increased workload and demands that COVID has brought at George Washington University School of Public Health, where she is the dean and director of programs there, the demands on her time have increased greatly, so she's not able to be with us this evening, but we thank her always for her input and her sharing her wisdom and her time with us. At this point, I also want to thank a group of members of the temple that we appointed to be a task force to work with our medical team to help us decide and make decisions, recommendations of how we'll go forward. Betsy Broder, Andy Lipstead, Ed Wendell, and Marcia Silcox have been working with Dr. Katz and Dr. Skorton, helping us make these decisions as how to navigate going forward as we do want to reopen. So at this point, I'm going to turn things over to my two dear friends, the two doctors with us. I will drop off, and the two of them will engage in a conversation where we will be listening eagerly to how we can live wisely and healthily in the coming months. Thank you both for being with us.
Well, thank you, Rabbi. It's wonderful to be here, and we thank you and everyone for arranging these opportunities to talk with our friends and neighbors about what's happening. So I want to give just a very brief summary of where I think things are right now. So the good news, and there is some very good news, is that we have effective vaccines, and that getting vaccinated against COVID-19 is a very powerful thing that we can each do as individuals. That will lower the risk of us getting an infection. It will lower the risk of us getting a severe infection, lower the risk of getting hospitalized or, God forbid, dying. And very, very important to do that. And we have some work to do in that regard to all take a deep breath and decide to be vaccinated. If I could have one thing that I implore all members of the Micah community to do, that would be to get vaccinated. And so that's one piece of good news, that we have this wonderful vaccine. Secondly, we do have treatments for COVID-19. And it has allowed us to be a little more effective in dealing with some of the more severe cases. On the other hand, we have some very profound challenges. And one challenge was sized up by our colleague, Richard, and my colleague, Dr. Francis Collins, who is the director of the National Institutes of Health. And I'm going to look down here so that I get the quote correctly. He said in an interview just a couple of days ago, quote, "Delta came along, and it's almost like we have a new pandemic now. Everything we thought we knew about COVID-19 has to be revised," end of quote. And so the Delta variant, which is the predominant type of virus that's in the country now, in this country, and in our community, is a fearsome virus that's very contagious, easy to pass from person to person. And so we have to continue to take very, very seriously the public health precautions of masking and social distancing and so on, that we thought, we hoped, we prayed were behind us now. So we have some good news and bad news in that regard, and a lot of ways that we can keep safe, keep our families safe, keep ourselves safe, and keep the Micah community safe. Richard, over to you.
Well, thank you, Dr. Skorton. This has been an interesting run. Who would have imagined in January 2020 that we'd be still looking at this as we approach Rosh Hashanah 5782? I think all of us are more than shocked that that this has extended that long. And now the Delta variant, and you're going to hear about this much more tonight, has really changed everything that we are thinking about how the future is going to approach us. Early this summer, we were talking about the return to our sacred home. And there were lots of people who were very optimistic, thinking that we should be able to get back in live and maybe masked, maybe not. And it's very clear now that we just can't do that. What we are facing is another severe problem. And I think it's come as a shock to many people. Other people were expecting this and preparing for it. And it's fortunate that we do have a vaccine, but what's difficult to imagine is all the people who are refusing to get vaccinated, whether it's from fear or anxiety or irrational or bad news, whatever it is, it's going to prolong the length of this pandemic. In fact, some people think that this is going to prolong it so much that this is going to become what's known as an endemic, that the coronavirus could be with us, much like other viruses, seasonal flus and things like that, could be there for a long time. As I commented to the team earlier, and I've said this a few more times, that had internet been available, or Breitbart, or this red-blue division in the country at the time of Jonas Salk and Albert Sabin, at the time of polio vaccines, we might still be dealing with polio. So this is a frightening time for all of us in healthcare. Those of us who, I'm not exactly on the front line, but I have people who are on the front line. And what's happened now is just, and I'll talk about this later in terms of pediatrics, is just what we're preparing for, is a continued presence of this virus and a continued surge that we have not seen the peak of yet. So we'll talk a fair amount about all that. Dr. Skorton and I are going to do an informal chit chat up and back. We have a group of questions, and I'm going to just run through the list quickly so you know where we're going to go. We're going to talk a little bit about the past and where we've been. And we're going to talk about the Delta virus and breakthrough. We'll talk about booster shots, whether or not vaccines should be mandatory. What about household infections and quarantine? The big one that's in the news now is pregnancy and vaccination. And we'll talk more about masking and hygiene and social distancing. And the area that I'm very involved with is the protection of our young children. And so we'll go through all those things. We'll try to keep this as informal as possible. I know there'll be questions that you can put into the chat. And if there's something pressing, we'll get interrupted and answer the question, but otherwise we'll probably take some questions at the end. So Dr. Skorton gets the honor of answering the first question. And I should put this in the form of a phrase, and you can answer it in the form of a question. We could do a Jeopardy here. The Delta variant, the breakthrough infection, what about it, and what does it mean about waning immunity, and what are we going to talk about in terms of booster shots? We know we're going to get another one now, but how often do you think we're going to have to get them?
Dr. Katz, thank you for sending me a difficult question right from the start. It's a very important one. So as we mentioned, the Delta variant is an infection that's easier to pass from person to person. And even those of us who are fully vaccinated, Dr. Katz and I have both been vaccinated for, what would you say, Dr. Katz, about 8 months now, something like that?
Yeah.
Yeah, it's seven and a half months for me. It's conceivable that we could get a breakthrough infection. The efficacy of the vaccines, even before Delta, was not 100%. They were very, very high, but not 100%. Very few things in life are 100%, even in biology and medicine. And so breakthrough infections could have occurred, and they can still occur. I want to say this strongly, and Dr. Katz and I will try to make this point throughout the evening, and that is, again, with vaccination, the chances of getting a severe life-threatening infection are much, much lower than in the unvaccinated. And the proof of that is that if you look at the hospitals around the country and right here in the greater DC area, who are seeing an uptick, a surge really, in cases, that surge is predominantly among those who are not vaccinated. So although there can be breakthrough infections, and it's possible just as it has been throughout the whole pandemic, it's possible to carry this virus without having any symptoms and pass it along to someone who is not vaccinated, such as a child under 12, where there's no vaccine yet that's been authorized for use. And like any vaccine of any kind, there is some waning immunity over time. And just before we hit the green light on tonight's webinar, Dr. Katz was telling me that in his experience, folks who are immunocompromised and therefore at very high risk if they get COVID, followed by healthcare workers, will be given the opportunity to receive boosters. He and I think in the next several weeks, certainly by next month. And the implications for Rosh Hashanah and Yom Kippur, this is the tough one. Let's try to get this out of the way at the beginning. And of course, we'll be very, very thrilled to answer questions along the way a little bit later. This is a decision that every single person has to make, just like every decision in life. And I personally am going to attend the services virtually. I'm going to tell you what went into my thinking about that. I'm 72 this fall. I've got asthma, so I'm at a little bit higher risk. And that's on the negative side. On the positive side, I believe that our rabbis and Deborah Winter and the other staff at Micah have done, in my view, just a superb job of having services every Shabbat and throughout in a virtual sense, very meaningful, moving services. And so for me, it was a decision of personal risk and my own thinking that I've decided to go with the virtual option. And I'm so grateful to the rabbis that we have that option. It's going to be each of your decision, obviously, and it's wonderful that we have the different options. So Dr. Katz, that's an answer to the first one. Thank you.
Yeah, I agree about the virtual service and how wonderful they are. I think virtual services, as the rabbi would say, are the new modernity. And I think we'll be living with that for quite some time. As we continue to talk about vaccines, do you think they should be mandatory at workplaces? And what's the downside?
Well, that's a real tough question. Every employer, I'm an employer, you're an employer, every employer has to decide what mandatory means. Does mandatory mean if you don't get a vaccine, you cannot come to work? And there are some jobs in our society, many jobs, where you can't do the work from home. I'm blessed with a job leading an organization where I've been able to lead that organization virtually since March of 2020. And we're not planning to come back to our offices till January of 2022. But a lot of other people are not so fortunate to have those kinds of jobs. And so I do think the more people are vaccinated at workplaces, the better it would be. And I've worked with others to bring medical organizations together to urge, for example, hospitals and health systems to make it mandatory. And many, many more hospitals and health systems are moving in that direction. University of Pennsylvania, for example, made it mandatory throughout some time ago. And Dr. Katz can talk about the wonderful institution that he is affiliated with. But I do think in an ideal world, vaccines would be mandated. Unfortunately, there's a lot of people who are very skittish about the vaccines. And so in addition to making them mandatory, we have to convince people, we have to listen to their concerns, and we have to deal with their hesitancy, some of which are based on distrust of the medical system. And for those in the Black community, for example, in our country, they have very good reasons to be suspicious and concerned about the medical system. So a complicated calculus, but I do think the closer we can get to mandating vaccines everywhere, the better off all of us will be. So Dr. Katz, I think it's my time to put you in the hot seat now, which I've been looking forward to for the last few minutes. Now here's a hypothetical. Should there be an infection or exposure in the household among the vaccinated, what is the current protocol for quarantine? And what about the situation if a school communicates that a class in school has a case? What do we do then, Dr. Katz?
Well, let's start with if the exposure part of that for an adult. If you, as an adult or a child over 12 who's been vaccinated and have been exposed and are asymptomatic, there's no need to quarantine. If you do have symptoms such as sniffles or cough or any of the upper respiratory things, the people do recommend staying home until you're asymptomatic or afebrile for at least 24 hours, but also then getting a COVID test to be sure that you are clear. And if you're still positive and still symptomatic, you do need to quarantine for probably 10 days. Now, if you've not been vaccinated and you are exposed, it's a real exposure, and a real exposure means at least 15 minutes in the same room, unmasked, or even a cumulative period over 15 minutes in a 24-hour period unmasked. That's a real exposure. And then you should be quarantining for 10 days and getting a COVID test before any return to work. The more difficult one is exposures at school. So it's very clear that children who are under 12, none of them have been vaccinated. And there are increased risks of that happening as we return to school. And that's what we're most concerned about. Most schools should have a protocol in place for how they're going to well, at least in the blue states, the schools will notify the families of an exposure. If your child is exposed and asymptomatic, there is no need to be concerned, but we do recommend keeping the child home for a 5-day period and then getting a COVID test before returning to school. The parents, however, are not necessarily therefore exposed. If your child has been exposed at school and you bring your child home, you are not necessarily exposed. So you don't necessarily have to quarantine. Of course, there are breakthrough cases like this where a parent will get it from their child, but they'll be symptomatic and then still need to then quarantine themselves. So it's a complex calculus, and it depends on how well the schools are going to report this and how honest parents are in reporting to the school that their child has COVID. So we're going to see how that plays out in the fall. We've in the northern part of the country, we're seeing how it played out in Florida and Louisiana and Texas, and it's very disturbing. You're on mute.
Sorry. You'd think after 17 months I'd know how to do that. Dr. Katz, if it's okay, I'm going to introduce an occasional question that's coming from our colleagues when it fits in the conversation. We talked about the booster a little bit earlier, and we have two questions. I'm going to throw one to you, if that's okay, Dr. Katz. It says, we can get our booster this fall, okay, talking about the COVID booster. This person asks a really important question. Do we also need to get our yearly flu shot this fall? Great question. Dr. Katz?
Yeah, absolutely. It's vital to get both shots. There is some controversy as to whether you can get both shots at the same time. Most of the people who recommend getting both shots recommend a 2-week interval between the COVID vaccine and the flu vaccine. But this is going to be a significant flu season, which we did not have last year because everyone was very diligent about masking, social distancing, and the flu season just dissipated. We don't anticipate such luck this year. We think that we're going to have a flu season. We're going to have a respiratory syncytial virus season, which is a common significant pathogen in young children. So those two viruses plus the COVID could make it a very, very difficult fall. So yes, please get your flu vaccine.
Thank you, Dr. Katz. I'm going to try to answer the next one, but please jump in if you have something to add, as always. This question is another good one. Do experts know the right time to get a booster for the biggest benefit? Israel did it at 6 months. Biden said 8 months. Is there an optimal time? And I would say we're still figuring that out. Israel has been blessed to be able to vaccinate a very large part of the population, which, by the way, they had a lot of breakthrough with Delta as well. And they're deciding to go for the booster a little bit earlier. I think the idea of getting a booster about 8 months seems reasonable. I do not think there's sufficient data to pinpoint an actual optimal time, because different people will have different responses to this vaccination like they do to every vaccination. So I think somewhere in that range seems reasonable. Dr. Katz, would you agree?
Yes, I agree. And in fact, there was a headline in one of the news channels just this afternoon that the administration may be recommending 6 months instead of 8 months that the CDC recommended. So yes, it's very clear that the data is confusing, and that's been the problem with the whole process with COVID. There's a lot of data that comes in, gets released to the press, and not well vetted. So there's always some confusion with this. Those of us in medicine who've learned to deal with shades of gray know this is no different, but there's lots of people who cannot cope with that. We need a straightforward answer. We need it now, and this virus is just not giving us that opportunity.
And I might say for anybody listening, perhaps a young person who's aspiring to a career in medicine, get ready for making decisions under conditions of uncertainty. That's the way medicine works. Last quick question from our viewers. Given the much higher viral load with Delta, this is really to you, Dr. Katz, you mentioned 15-minute exposure. Given the much higher viral load with Delta, is a real exposure 15 minutes or is it much less?
Well, yeah, conventionally with the prior to Delta, it was 15 minutes. That's still being published. People think that it could be as little as 5 minutes over a 24-hour period. That hasn't been absolutely validated yet. But, I think if you know someone who's been quite ill and you've been exposed for even 5 minutes, you might want to consider that a reasonable exposure and take the proper precautions.
It's interesting, Dr. Katz, haven't had a chance to tell you this, but I was contacted some weeks ago by a contact tracer because somewhere that I ate outside, someone at that facility had tested positive. And so I was asked to get a couple tests. They were negative. And so we're figuring our way through this, and I have no idea if I had any exposure at all. Okay, one more question for you. There's been a lot of discussion, a lot of questions about the guidelines about pregnancy and administration of the COVID vaccines. What's your take on that, Dr. Katz?
Well, I'm going to base it on the American College of Obstetrics and Gynecology, who are very adamant that pregnant women should get vaccinated. Breastfeeding women should get vaccinated. There is much evidence to suggest that pregnant women have a much worse course with COVID-19 than vaccinated women would. And there's no evidence that the vaccine will penetrate through the placenta to the baby. And there's no evidence that breastfeeding as a vaccinated mother will cause any detriment to the baby. And since we deal in my business with lots and lots of babies, we're recommending that everyone who is attempting to get pregnant, who is pregnant or has been pregnant, should get a vaccine.
By the way, I've just been asked to mention that although we do have one more question, please keep asking the questions, in the YouTube chat function. That would be great. Okay, back to you, Dr. Katz.
Now, so yes, I know people are very concerned about that. There are a lot of people who are trying to opt out of mandatory vaccinations at their institutions because of pregnancy. There is no evidence to suggest that anyone will approve of that now, and maybe except in very, very rare cases. So I know in our systems that is not going to be an acceptable reason for not getting a vaccine.
Okay, I think it's over to you now, Dr. Katz.
So as we move on and talk about masking, distancing, hygiene, well, what do we say about services? I know you've already commented that you're going to do yours virtually. I'm going to do mine virtually. What are we going to tell people who are a little more bold than we are in terms of attending services in person?
Well, definitely do those public health measures, not just the services, but when you go inside anywhere, as is mandated right now in DC, for example, masks, yes. And let me comment on masking just for a moment. There's masks and then there's masks. Putting, sorry, I'm having one of those moments where I can't think of the word, that sort of a bandana thing that you can pull up over your nose. There's another word for that. I'm sure Dr. Katz knows. He's a youngster compared to me. Is not very effective. What you need is something that fits closely around the nose and around the mouth, covers the nose and goes well under the chin. And yes, everyone should be doing that. Inside, we should be thinking about distancing, and we should be thinking about hygiene as we reconvene for services. I do think that the to speak in favor of the plans that the rabbis and Marcia Silcox and others have made. I think that the way Micah is approaching the High Holy Days is just right. They're having fewer people at the indoor services. They're having therefore space between them, and everyone has to wear a mask to get in and stay in. So I think that's the right thing to do, and I applaud the rabbis and the Micah leadership for doing it that way. And I wouldn't want to be misinterpreted. The fact that I'm going to do it virtually doesn't mean that I think everybody should do it virtually. It's an individual choice, but I think the way Micah has set it up is exactly right. Now let's see. Oh, great. I like the part where I get to ask you questions, Dr. Katz. That's my favorite approach. What are we seeing in pediatric populations, and what are the best ways to protect kids, including and especially those, as you've mentioned, under 12, too young to have vaccines with emergency use authorization for that age? Dr. Katz?
Well, we have an experiment in vivo going on right now in the South. Florida, Texas, Missouri, Louisiana have incredible numbers of children in their ICUs. They're filled both with COVID cases and non-COVID cases, and children are being flown out of the state to any hospital that will take them. So we've been asked, and not my hospital in particular, but hospitals in Maryland have been asked to take children from the South because they've run out of beds. They've run out of staffed beds. They don't have enough facilities or enough nurses to be able to handle those. So we know that this is affecting children far more than we ever expected to. There have been about 130,000 children who have been infected with this. Most of them have done well, but that's prior to Delta. Most of them have done well with very mild disease, very few in the way of hospitalizations, and almost no deaths, although any death is too much, obviously, but there were remarkably few, especially in Maryland and further north. That's changing. There's lots of children now who are on heart-lung bypass because their disease is so significant. And the saddest part of this is that many of them could have been prevented if the adults around them have cared for them properly. Now, there is no vaccine available for children yet. It will happen, but probably not until the end of the year or the first of next year. Studies are still going on trying to figure out what the appropriate dose is. But if the adults around them had masks, it's much more likely that they would have had either less severe disease or not had disease at all. So this is a problem with the adult world creating a problem for defenseless children.
Here, here. By the way, as Dr. Katz knows, Deborah sends us a special signal that goes right to our frontal lobes when the rabbi has a comment to make. So I'm going to read one that's in there. The rabbi wanted us to add, Dr. Katz, that about the services, he said that everyone gets the benefit of shorter services, 90 minutes. I like a service of any length as long as it includes a nice long sermon by Rabbi Zemmel, but that's another story.
Wait, if that isn't pandering, those of us who are shocked to hear a rabbi say that the services are shorter as a benefit. I didn't think that was in the rabbinical blood. So that's great, Dr. Skorton.
Well, I'm not going to start comparing his sermons to those of the other two rabbis. I'm not going to say, who I'd rather hear on a given day. I'm just going to leave that be. Here's a question before we get back to our planned questions. Do you consider cancer patients who have completed treatment, chemo and or radiation, immunocompromised always? Or is there a time frame when your immunity returns to normal? I'll take a stab at this one, Dr. Katz. Cancer is such a broad term. The very best thing is to check with your physician and not ask us a question like that, because it just depends. And it depends on the stage of the cancer or what was done exactly, what kind of chemo and radiation. So certainly that's something where it's very, very important to take your physician's advice. Dr. Katz, would you agree with that?
I completely agree with that. Yeah. There's no harm in getting a vaccine, but really in terms of whether or not you're considered immunocompromised, that is truly between you and your physician. Yes.
Yeah, and thank you for making that point that there's no harm in getting a vaccine. Very important. Here's a great question. I'm getting on a 2-hour commercial flight tomorrow morning. What type of masking do you recommend? Cloth with surgical over, KN95. The most important thing is that it fits well, fits tightly. Some folks believe that double masking is extra good. Can't go wrong by putting a double mask on. The key thing is to have it fit closely. So you could have the best material, like the kind that Dr. Katz wears in the hospital. If it doesn't fit right, it's not going to get the job done. So that's the most important thing. And I think any of the options that the person mentioned, cloth, surgical mask, KN95, as long as it fits tightly and well. And sometimes you see folks with the upper part of the mask just under the nostrils. That won't get the job done. So something that comes up like this and goes around like that is important. Um, okay, back over to you you have the helm now, Dr. Katz.
So I think we've addressed this, but I'm going to just make sure we reinforce this, that what is the chance of getting COVID for those of us who've been fully vaccinated? And, we talked about the waning effect of the vaccine. Anything new anything more we should talk about with that?
Just that it's very important to get vaccinated, and that even as the effect of the vaccine wanes, it's still effective and way, way, way better than not having vaccine at all. And so if you hear somewhere on a news program or you hear from a neighbor, well, why go through all this? These folks are admitting that it will wane over a period of time. There's no evidence that a person who is vaccinated is not way better off than a person who is unvaccinated, no matter how the length of time that we're talking about right now. When boosters are recommended, as always, I recommend that anyone listening here check in with their physician and ask, where they line up. But I'll check up with my physician. When my physician tells me it's time, I will line up. But please know that even if you were vaccinated in the middle of the winter when Dr. Katz and I were, still to this day, we're quite a bit protected from a severe case of COVID.
Absolutely.
Let's see. If we do get a mild case of COVID, Dr. Katz, what about the long-term effects? What's the difference between COVID and the influenza over the longer term? Should we work harder to not get COVID than we do to not get the flu? Dr. Katz?
I can't say enough about the fact that we should work much harder to avoid COVID than the flu. The flu is generally, not always, generally milder than COVID has been. It will last for 2 to 5 days, often resolves on its own without any additional medical therapy. COVID, however, may not, and can require much more in the way of intensive medical therapy, including relatively new medications and hospitalizations, intubation, things of that nature. That said, there are deaths as a result of the flu, but there have been far more deaths as a result of COVID than there have been in any one year. In fact, probably more deaths have occurred from COVID this past year than in 10 years of adding up flu deaths. So there's a significant difference between them. Although, one of the things about long-term is that there is a disease called long-term COVID, long hauler COVID, that can have significant effects, cardiac effects, muscle aches, pulmonary effects, some neurologic effects. So even when the disease is over, there are people who have significant manifestations of medical illness afterwards. We're starting to see that in children now, which we hadn't seen before. And so this is a problem disease that is, as Dr. Skorton said earlier, I think we're learning more and more about a relatively new version of the same virus.
Now, I want you to know, Dr. Katz, I'm not trying to make you work harder, but here's a question that says, question for Dr. Katz. So, I'm a servant of these questions. The question is, how far behind the authorization for 5 to 11-year-olds do you think the 6-month to 4-year-olds are? Can we expect these to be two separate groupings for emergency use authorization, Dr. Katz?
I believe that's going to be the case. The reason is that they're trying to figure out the dosing of the vaccine for children. No one wants to give the children the same dose as young children, the same dose as adults, for fear of a hyperimmune response that could make them just as sick as if they had COVID, which is, we think, what happened at the beginning of this COVID pandemic. So I think it's going to be the end of the year for 5 to 11-year-olds. Probably the next group will be 2 to 5, and then they'll try to figure out about what to do about younger children than 2.
Now here's a question in the chat and a question that we had lined up that are about the same, and they both have RK next to them. So I'm assuming RK is you. So it says, can you offer more advice about how a vaccinated person can decide whether to attend an event like a reunion where everyone is vaccinated, services, or a meal at an indoor restaurant with friends? So the real question is, how should we be living these days given these uncertainties? I'm so glad you're answering this one, Dr. Katz.
Well, I will take the first shot at this, but I'm not going to let you off the hook on this, I think. So I'm only going to tell you what I know that I've done for myself. I cannot eat in a restaurant, period. I'll eat outside, and I may stop that as well. But I have not been able to bring myself to eat at a restaurant. The hospitals are now preventing all of us from attending multi-person gatherings outside the hospital. We are restricted from having multi-person gatherings within the hospital. So my hospital is going to have their 99th year gala in October. That's being canceled because we're not allowed to have that kind of risk taking for those of us who have to then care for our patients. So I think the answer is I probably would do as much virtually as possible. It's less fun, it's less rewarding, but I think it's that much safer, that much safer. You're muted.
Sorry. I agree completely. Here's one that I'll take. It says, do you need to get vaccinated even if you've already had COVID? And the answer is yes. There are tests that can measure antibodies, but the recommendation is that you get vaccinated. That's a different level of immunity, we believe. And there's a lot of variables in how much immunity you can get after any viral illness.
Correct.
The helm is over to you, Dr. Katz.
So I think, we've got a few more questions about, groceries and buying things online. I won't go into a restaurant, but for some reason I feel better going to a grocery store because I'm not stationary in the grocery store. It's a bigger environment. I'm going to presume that all grocery stores have handled their air handling a little differently and that they're much more, the air handling is better than a cozy, comfortable, dark restaurant might be. So I'm okay doing that. So I think that that's probably a safe place to go. Obviously, I think you should be masked even if your community isn't mandating it. I have not yet gone into a store without being masked. In fact, I don't, as a rule, I don't feel comfortable not being masked, even walking to my car from the hospital. So I think, our masks are our best friends in this and will be for quite some time, whether it's, a cloth mask or a surgical mask or an N95. And as an aside, the hospitals now are starting to talk about all medical people wearing N95s all the time. And they're much easier to get now. I think it's much more likely that the N95s, if they're made in the United States, are reputable. There was a product, we got a product recall today from a mask made in China. So if you're going to go buy N95s and you go on Amazon, please make sure, or wherever, please make sure that it's made in the US, most of them, and NIOSH certified. Not NIOSH approved, but NIOSH certified. And that will probably guarantee that your mask is real and safe.
I have the same attitude that Dr. Katz has about wearing a mask. I never stopped wearing a mask indoors in stores, even when it wasn't mandated. I don't wear a mask when I'm walking outside and there's no one around me. I go to take a walk. When I run into a bunch of people, I put my mask on. I should have said in the beginning, Dr. Katz, but I do want to say this, not as a disclaimer, but just as a sort of a reference setter, that I'm quite conservative about these things. And I think it's better to be on the safer side, but there's others who feel a bit different than that. So, obviously by my decision to do the services virtually, you can tell that I'm on the conservative side in that sense. In the service sense, I'm reform all the way. But that's a different story.
Yeah. And by the way, don't wear a gaiter. That's what Dr. Skorton
Gaiter,
was trying to do.
Gaiter, yeah. Gaiter is what it is. Thank you. Yeah, I couldn't think of that word. I appreciate that. Okay, now we're going to go back to our question lineup here. I'm going to go back here and make sure we didn't miss any. It says during a year of pandemic isolation where we saw virtually no influenza, this is a point that Dr. Katz made earlier, we had close to 350 pediatric COVID deaths. This is a typical flu season. Do you think we'll see worse in children this year? I think we will.
Oh, absolutely.
Yep.
You're absolutely correct. We are seeing it now.
Let's see. Groceries we talked about. Okay, here's one. If a vaccinated person gets the Delta virus, which by the way, if you get COVID, there's a very good chance that it's Delta right now. If a vaccinated person gets the Delta, in other words, a breakthrough infection, is there a delay in getting a booster shot given the exposure? What if one gets Delta, but without any symptoms, so you might not know? I would say that the decision on getting the booster is going to be based, I believe, on the length of time since you got your second regular dose or your one dose, depending on what you got, and where you fit in these categories of people. So those who are immunocompromised, those who work in the healthcare setting, those who were vaccinated a very long time ago, then those living in skilled nursing or nursing home type facilities, then people of advanced age like me and so on. I think the country will probably go in that direction. But a lot of this will depend on the availability of the vaccines and on advice from the CDC. Anything to add to that, Dr. Katz?
No, I think that's correct. I think that's
Okay,
absolutely
let me make
correct.
sure we didn't miss anything here. Um,
No.
what about outdoor sporting events like baseball games? Um, and important question for the Micah community. Richard, what would you say about that?
Well, I think if you're a Baltimore Orioles fan, you could probably go to a game. There are so few people there that social distancing is not a problem. That's very sad to say. But in general, I think if you're out, this was true several months ago. If you're outdoors, there's nobody around you, you should be okay. But I'm worried about this upcoming football season where the stadia are supposed to be filled. And I think, and people tend to drink a lot. They tend to take their masks off while they're there. I think there's a little more risk in sitting in a very crowded stadium with people who might have a little more chance of becoming inebriated. So, it's a risk. I think obviously it's a personal decision. I'm not sure I would go to a football game, but I would feel comfortable going to an Oriole game now.
Poor Orioles. Here's a question. Straightforward question. Do you suggest that folks at risk should stay away from services this year? That's really got to be a personal decision. It's too general a question, too general an adjective to say at risk. I think that again, I say this in all sincerity. I think the way that the rabbis and the other folks planning the services have set them up, they've tried to de-risk the services as much as humanly possible. But if you believe that you're at risk and you want to get advice on this, it's best to ask your doc. I made my decision partly because of advice, partly because of my age, partly because I have respiratory issues because of my asthma, and I would maybe not do well if I got COVID. But it's hard for us to give you advice in that regard. I don't want my interpretation of my decision. I believe Dr. Katz would agree with this, or his decision to go virtually, to say that nobody should go to the in-person services. The synagogue has worked out a way to make them less risky and shorter, especially if everybody cooperates and wears well-fitting masks. Dr. Katz, anything to add to
No,
this?
I completely agree. I think the synagogue has really tried very, very hard to make this a fair and equitable way to get to services for those who want to attend and in a safe manner. So yeah, I completely support that.
Here's an interesting one for you, Dr. Katz. I say for you because I have no idea what the answer is to this one, so I might as well unload it on you. Is outside exercise like bicycling still safe without masks?
I think so, yes. I mean, I wouldn't be in some giant Peloton with everybody sweating and spitting on you, but I think if you're outside with someone who lives in your pod and you're bicycling, you should be safe without a mask.
Here's a question. If we get a third booster, how much safer will we be? And no one can give a specific, precise numerical answer to that, but almost certainly a third shot, a booster, will increase the immune response. except for people who have a very big problem with immune response. But for the vast majority of us, it will help, and it is worth doing when it becomes
Absolutely.
a recognized thing. It says, what evidence is there for protection from reinfection after natural infection versus the vaccine? It says, I'm in Kentucky, and Senator Paul has quoted studies from Israel that natural infection is more protective. Dr. Katz?
Wow, what a loaded question. Thank you, Dr. Skorton, for sending that my way.
Sure.
So I don't think that that's true. I just don't think that that's true. And I think that the vaccine does offer a better protection. Natural infection is true, it's real, but the vaccine, I think, offers a far better protection. I think there's studies that have shown that. Senator Paul and Dr. Fauci, Dr. Senator Paul and Dr. Fauci have come to blows about reliability of some of his data. And I think if I were a betting man, I would bet towards Dr. Fauci 99 times out of 99 times. So I think Dr. Paul is misinterpreting data.
I agree. It says, can you tell us more about what living with an endemic means? We become a mask-wearing society more regularly. So I'm going to give a little thought on this one for Dr. Katz to also jump in on. I do think if we have a seasonal appearance of a very severe transmissible virus, I think that the periods of time between which we are not using public health measures will get narrower and narrower, but it's really too soon to tell. And if, as Dr. Fauci has mentioned, and many, many others, including Dr. Katz, if people would get vaccinated, if we had the much, much larger proportion of our population vaccinated and also followed the public health measures, I believe that we would have much better control of this pandemic, even if it came back seasonally, and we would have periods of time where we would not have to be as cautious. But we're not even close to that right now. So it's hard to predict the future. But I think for right now, we just have to do these things. And there's some people who have mentioned to me in other settings, other discussions, would I reconsider some of our social habits like shaking hands? And it's a tough question. Right now, I'm still a little skittish about shaking hands, although I saw a physician for an injury that I suffered recently, and he put his hand out right away and I shook it. So I have to admit that I've become much more conscious of these sorts of things. And there are other cultures, those of you who have had the pleasure that I have of working or visiting or traveling in East Asia, many parts of East Asia, people will wear masks long before COVID. So I think we may change our habits somewhat as a society, but I don't think we'll change too much in America. But I think for right now, it's good to follow the sorts of things Dr. Katz said. Want to add anything to that one?
No, the only thing I would say is that, we have developed handshake as a mode of, connecting personally. I think people are getting the idea of elbow bumping or fist bumping and or not being offended if someone went and used Purell immediately right afterwards. I'm not offended. I don't know if others are. But the important thing is that we need to teach our children what appropriate manner of communication is appropriate. And my grandchildren wear masks, or at least one of them does routinely, and doesn't think twice about it. And I think as we get more and more used to this, I think what was a normal is going to be, we need a new normal. And so that may be not handshaking, and it may be wearing masks more often. And as you said, Dr. Skorton, we don't know what the future is going to hold, but I think it's going to look different than where we've been, at least for the next several years.
It's interesting. I have to just share a quick humorous vignette, at least I hope you think it's humorous, about Purell after shaking hands. When I was a university president, I used to shake many hands at commencement, dozens and sometimes hundreds of hands. And this was a long time ago, way before any of this came up. And there would always be a staff colleague at the end of the commencement waiting for me with a big bottle of hand sanitizer, long before any of these things occurred. Someone has a question I think this is for you, Dr. Katz, because I think I'd rather have you answer it. It says, what is an N95 mask and why is it better? Are KN95 good to use if not NIOSH certified? So difference between KN95 and N95, there is a difference, Dr. Katz?
There's a difference. The N95 masks are generally surgical, are generally worn in a hospital, and the KN95s are used for other areas where particulate matter is a concern, such as construction, things of that nature. However, both of them, because they are 95% effective in blocking certain particles down to a very small size, including the size of the virus. So either of them would be fine. The only caveat would be to not get a mask that has an exhalation valve in it. So you need a solid mask and not one with a little black spot or little white spot on it, the plastic spot. That allows you to exhale, and that's fine if you're working alone in an environment where there's hazardous material, but it's not good for protecting anyone else around you. So if we see that in the hospital, we take that off immediately and give someone else another mask, or put a mask on top of that, or put a piece of tape over it. So I would recommend staying away from anything with an exhalation valve.
Thank you, Dr. Katz. Here's two I'm going to put together. I'll try to answer, and then you can correct any mistakes I make. Although I hope you'll do it in a kindly way. One person says, I'm in the twilight zone. I was vaccinated in February, so probably need a booster soon. I'm scheduled to fly before I'll be able to get a booster. Am I now at higher risk? And another one says, how do you feel about vaccinated people flying on planes or taking the metro with masks, of course? So this, to me, goes along this sort of continuum of risk. Whether you just got a booster 2 weeks ago, or whether you are 8 months since your shot, going on a plane or in public transportation, you should wear a mask. Whether you are fully vaccinated, recently vaccinated, or not, you should wear a mask. And in terms of should you take the metro or fly on planes, it just depends on what the circumstances are. Some folks in our community have to take public transportation to get to work, don't have the luxury of the kind of job that I have where I can work from home right now. And so we need to do everything we can to convince those folks to be vaccinated, and to convince everyone on public transport to follow the rules and wear a mask. And I believe if people were vaccinated to a very great degree, that is almost everybody vaccinated or everybody vaccinated, and we wore masks, that I think then that flying or going on public transport would not be a super high risk endeavor. However, right now, not everyone is vaccinated. So if you need to go, I think you go and wear a mask. And before you get on the plane, try not to sit around in crowds too much in the airport itself, if that's possible. Planes themselves have very good air turnover. When you're in the plane, very good air turnover. And the difficulty in the plane is if you run into an obstreperous person who just doesn't want to have the mask. And that's happened in trains. It's interesting, Dr. Katz, I was reading that Amtrak has a policy now that if a person won't wear a mask, they let them off at the next station, something you can't do on a plane. We have about 90 seconds left before we're going to turn this back over to the rabbi. Do you have any last minute thoughts or summary thoughts, Dr. Katz, you'd like to share?
Yeah, I think if you're going to travel, take your vaccination card with you. Some people are requiring that before you can enter. Well, especially in New York now, it's going to happen in some places here. The Baltimore Symphony is requiring it as well. So take your vaccination card with you, or a facsimile of it, both front and back. For reasons that aren't clear to me, they want to see the back as well to make sure that it's real. So I take that with you.
And by the way, just a quick note, in case somebody tells you to get your vaccine card laminated, don't do it. Because when you get a booster, they'll want to write that booster in there. I think carrying it, or second best would be a phone. Take a picture on your phone. Some places will say either the card itself or a picture on the phone. So if you travel with the card, be careful with it, because that's a very important proof. And even if you travel with the card, take a picture on your phone,
Right.
And store it in the cloud. Dr. Katz, I want to thank you, and I want to turn this back over to Rabbi Zemel.
Well, I want to thank both of you for this sobering yet really highly instructive evening for all of us. I know I speak for our entire community. We are so grateful to have wise, patient, clear thinking experts like you who are so much of the fabric of who we are and help us all not only live more safely, but also feel more safe. In terms of services, we are doing our best, as my two good friends here, the doctors, have said, to make everybody feel safe as we will be re-entering the sanctuary together, some of us. And I'll remind you that we want everybody that's going to be coming in person to be vaccinated, and we are requiring masks, and we're requiring you to be fully masked the way Dr. Skorton described. As I said, we are going to keep the services somewhat shorter, we're trying to keep them at 90 minutes as we do a hybrid service so that everybody will be feel as safe, as comfortable as we can be. And finally, I want to just say one other thing as this question came in and the two doctors responded to Dr. Senator Rand Paul. I'm issuing at this point a takana. A takana is a rabbinic edict that prohibits Dr. Senator Rand Paul from quoting any Israeli authority whatsoever at all. So if you hear that Dr. Senator Rand Paul is quoting any authority from Israel to support his position, you can know that he is in violation of a rabbinic takana, and his suggestion should be ignored. So thank you both very much for this evening. On behalf of all of us, we are anxiously approaching the new year, and we know that sometime again in the fall, we're going to ask you to come back and further educate us as this pandemic stays with us. And now I'm going to say what I like to say to my very good friend, Deborah Winter: take us home.
The most important thing is on the other side. The most important thing is on the other side. The most important thing is on the other side of fear. Kol ha'olam kulo, kol ha'olam kulo, gesher tzar, gesher tzar me'od. Kol ha'olam kulo, kol ha'olam kulo, gesher tzar, gesher tzar me'od. Ve'haikar, ve'haikar, lo lefacher klal. Ve'haikar, ve'haikar, lo lefacher klal. The most important thing is on the other side. The most important thing is on the other side. The most important thing is on the other side of fear. Kol ha'olam kulo, kol ha'olam kulo, gesher tzar, gesher tzar me'od. Kol ha'olam kulo, kol ha'olam kulo, gesher tzar, gesher tzar me'od.
Thank you everybody who was with us. Thank you again to our two wise doctors. Have a good evening.